Hello, everybody. This is Gary. Today is Sunday, April 3rd, 2022. It is 1:35 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today I just wanted to report on the fact that I've been on the antidepressant Cymbalta now for about 8 weeks. For body pain, muscular skeletal pain, nerve pain, joint pain, and muscle pain. My vision is getting kind of blurry. I think it's because of the Cymbalta. I have to go to the eye doctor. I'm going to call them tomorrow to set up an appointment for an eye exam. It's not unusual in my history for a psychiatric medication to make my vision blur, even when I'm wearing my glasses. I think that's what's happening here. So Cymbalta as an antidepressant has been helping me get rid of a lot of the physical pain. It helps me sleep better. My insomnia has gone way down, but it does appear to be making my vision blurry. I had the same problem years ago with Thorazine and Mellaril and some other medications that I've taken in the past. Blurry vision is often a side effect of psychiatric medications. I'm certainly not going to stop taking the Cymbalta. It's helped a lot in the physical pain. It's helped a lot with my sleep. It's helped a lot with my anxiety. But other than that, my psychiatric symptoms today are pretty much under control. If you notice that my face is all red, it's because I was using lavender essential oil to meditate, and I would place it on my skin under my nose. And it smells pleasant enough, but apparently I'm allergic to it, so I can't use it that way anymore. I can't apply it directly to my skin. I was thinking of getting a room diffuser to spread the scent of lavender while I'm meditating. Essential oils can be safe, or they can be dangerous. Certainly don't take them internally. I mean, if this what it does to my face, just imagine what it would do to my internal organs. But my paranoia is under control today. My hallucinations are at a bare minimum. They're always there to some extent. My depression's not that severe. My anxiety's not that severe. My insomnia's not been a problem over the past few days. Today is Sunday, April 3rd. On the 5th of April, which is Tuesday, I have an appointment with the orthopedic knee surgeon. With the orthopedic knee surgeon about the pain in my right knee. We did an MRI of my right knee. My meniscus in my knee is torn in 2 different places very severely. And I have a fracture in my femur that didn't show up in the x-ray, but did show up in the MRI. It's likely that I'll need surgery, although I don't know that for sure because I haven't been in person to talk to the surgeon yet. That's what I'll be doing Tuesday. And on Wednesday, I'll be following up with my primary care nurse practitioner on Wednesday on the 6th. So it looks like surgery might be a possibility. If I do have surgery on my knee, I may not be able to get around, and I may need help from my care manager or a social worker in getting my meds picked up, going food shopping, and doing my laundry and keeping my apartment clean. If I'm stuck on crutches, I'm going to be very limited on what I can do for myself. I'm not looking forward to surgery. If it turns out that I need it, I've already had 2 surgeries in the past 12 months. One to remove part of my prostate and the other to correct urinary problems in my urinary bladder. The problem was solved, but now I got other medical issues going on. Surgery is never fun. I hate being under the influence of anesthetics and opioid painkillers that they give you after surgery. They only gave me a few opioids when I had surgery, enough for 3 or 4 days. I never got addicted to opioids. Opioids or opiates were never my drug of choice. I never enjoyed taking them. There's something I never got addicted to. When I had wrist surgery, I broke my wrist and they put metal screws in my wrist. I was on Percocet for a month, but I never took more than I was supposed to. When the prescription ran out, I didn't ask for any more and I didn't go looking for any more. I just never felt particularly good on opioid drugs, or opiates, or whatever you want to call them. Physically, I'm partly limited, but what I can do already, because walking on my right knee does hurt. I went food shopping today. Spent about $70 on food, more expensive than I normally would because of inflation, and I know we're all suffering through inflation and gas prices. I don't drive, but I'm still paying the price, because when gas prices go up, then obviously food prices go up, and we're all paying the price of gas prices and inflation. I am presently have nicotine lozenges in my mouth. I haven't had a cigarette in about 9 weeks. I had a lung scan done. I do not have lung cancer. There are nodules in my lungs, but the chance of them being cancerous are less than 1%. I do have emphysema, apparently, though, and it's a good reason not to go back to cigarettes, because the emphysema is in its early stages, and obviously I don't want to make it worse by smoking cigarettes. I had the MRI on my knee and the CT scan of my lungs done on the same day. And apparently I do not have lung cancer from smoking, although I do have the early stages of emphysema, which would only get worse if I continued to smoke cigarettes, which I have no plan to do. I have no idea when I'm going to be able to stop the nicotine lozenges, because I'm still very much addicted to nicotine. It's just that the nicotine lozenges are far less dangerous than cigarettes. So, like, comment, share, subscribe.